Diabetes is a chronic disease that occurs when the body does not effectively use insulin or when the body does not produce enough insulin. There are two main types of diabetes. Type 1 diabetes occurs when insulin production is deficient and requires daily insulin use. Type 2 diabetes impacts how your body uses sugar for energy, is related to lifestyle factors, and can be a combination of both insulin resistance and insulin deficiency. 95% of people with diabetes have type 2 diabetes. Symptoms of diabetes include unintentional weight loss, fatigue, feeling very thirsty, blurred vision, and urinating more often than usual. Since the year 1990, the number of people living with diabetes has increased from 200 to 830 million. Diabetes can cause stroke, heart attack, blindness, kidney failure, and the need for limb amputation. The good news is that the consequences of diabetes can be avoided or delayed by prioritizing healthy eating and physical activity and by using medications. Additionally, when it comes to type 2 diabetes, which is related to many lifestyle factors, avoiding tobacco, eating a healthy diet, maintaining a healthy body weight, and participating in regular physical activity can prevent or delay the onset of this condition. Individuals with diabetes who do not regularly participate in physical activity should consult with their healthcare provider before becoming more physically active. Regular exercise participation means doing at least 30 minutes of moderate intensity physical activity on at least 3 days per week for at least the last 3 months. If you have diabetes and meet the criteria for being physically active and do not currently have symptoms of the disease, then you can continue to exercise at a moderate intensity without the need for first getting medical clearance. If, however, you would like to do more vigorous activity, it is recommended to consult with your doctor first. Exercise recommendations for people with diabetes include the following. Aerobic exercise should take place on 3 to 7 days per week with no more than 2 consecutive days without activity. The intensity of aerobic activity should be at a rating of 3 to 4 on a 0 to 10 scale for moderate intensity or a 5 to 6 for vigorous intensity. A time goal should be to work toward accumulating 150 to 300 minutes of activity each week for moderate intensity or 75 to 150 minutes for vigorous intensity. Types of activity should include using large muscle groups during prolonged and rhythmic activities like swimming, cycling, and walking, or high-intensity interval training. Resistance training should take place on at least 2 non-consecutive days per week using a moderate intensity of 50 to 69% of your 1 repetition maximum, or for vigorous intensity, 70 to 85% of your 1 repetition maximum. You should include at least 8 to 10 exercises, performing 1 to 3 sets of 10 to 15 repetitions. Effective modalities include weight machines, resistance bands, free weights, and body weight exercises when appropriate. It is also recommended to incorporate flexibility and balance exercises on at least 2 to 3 days per week. Stretches should be held at a point of slight discomfort or tightness for 2 to 4 repetitions of 10 to 30 seconds, and balance training can be done for any duration at a light to moderate intensity. Here are a few tips to help you get started. Monitor your blood sugar levels. Exercise should be postponed if glucose levels are below 70. Optimal blood sugar levels prior to exercise are between 90 and 250. For individuals with type 1 diabetes, if pre-exercise blood sugar levels are 250 or higher and ketones are present, the exercise session should be postponed. If doing combined aerobic and resistance training, it is wise to do resistance training first if you have type 1 diabetes to lower the risk of post-exercise hypoglycemia. If you have peripheral neuropathy, it is important to emphasize proper care of your feet to prevent ulcers and lower limb amputation. Prevent blisters, keep your feet dry, use polyester or socks with a blend of materials, and carefully inspect your feet on a daily basis. Be mindful that the timing and dosage of insulin may need to be adjusted when exercising. Do not make these adjustments on your own, but consult with your doctor for guidance. Becoming more physically active can be a great way to lead a healthier lifestyle for those with diabetes. The guidelines in this video can be used as a starting point to get you moving in the right direction. If you have any concerns about exercising with diabetes, be sure to consult with your doctor before getting started.